Welcome to week 1 of the Revenue Cycle Bootcamp, your pathway to success in a healthcare revenue cycle career. My name is Gina Cornett. I am the owner and founder of RevenueCycleDecoded.com, and I will be your host and educator for all of the Revenue Cycle Bootcamp sessions. And I'll give you a little bit of my background here in just a moment. This is what we are going to talk about tonight. In tonight's session, we are going to explore an introduction to healthcare revenue cycle. And within revenue cycle, what types of careers are available that you may be interested in? What are the roles and jobs? And the career paths, salary ranges, and then a little bit of Q&A. So let's go ahead and get started. We'll dive right in. First of all, my name, as I said, is Gina Cornett. I graduated from Texas Tech University Health Sciences Center School of Nursing back in, oh my goodness, 1994. It's been such a long time. With a Bachelor of Science in Nursing, I did work in nursing for a while as a pediatric nurse. If you don't see an RN after my name, it's because I let my RN license go after a number of years and did not continue to renew it as I was raising children at the time. I also received my master's in business administration from Texas Tech University Rawls College of Business. I have my certified professional coder, certified professional biller, and certified professional compliance officer certifications from the AAPC. I have over 18 years of experience, including school and work in healthcare, in nursing, practice management, and revenue cycle management. And I am currently employed as a director of revenue cycle management with a company that provides outpatient services in hospitals throughout the United States. So I have experience working both with hospitals, facilities, outpatient facilities, and with physician practices and physicians. And my goal tonight is to help you understand what revenue cycle is in healthcare and where you might fit in if this is an area that interests you as a potential career. Because if it does, I have 11 more sessions of content to provide to you to give you a good, solid overview of everything revenue cycle related, which would include all of the background and foundational information that you would need to know and that employers are looking for you to know if you are going to apply for a career in revenue cycle. So what is revenue cycle? Essentially, it is all of the processes that happen and have to take place in order for a hospital or a physician office or a skilled nursing facility or a rehabilitation hospital, your physical therapist, etc., to accurately bill for the healthcare services that are provided from the time the patient first schedules an encounter until the final payment is posted and the balance is cleared. There are a lot of different things that have to take place in order for that to happen, and there are a lot of different roles within those functions and processes to make this happen. So, as you probably know, as a resident of the United States, healthcare here in our country is not simple when it comes to billing. And you may have at some point in time interacted with the healthcare system as a patient and have been familiar with the billing, have received bills yourself, have received statements from your insurance payer. You may have applied for insurance yourself or been provided with insurance through your company. And so it's a complicated system in the United States. And that is part of why it takes so many people to make sure that a bill for your patient can get dropped out the door, sent to the appropriate payer, and get reimbursed. And really, revenue cycle is the heartbeat of healthcare finance. Um, It is essential for the financial health and sustainability of healthcare organizations. If organizations do not have a strong, solid revenue cycle that ensures that they have positive cash flow, they cannot continue to keep their doors open and continue to treat patients. And we do see this happening throughout the country from time to time, and especially many organizations coming out of the pandemic have struggled financially, and it has led to closures of hospitals, closures of physician practices, because they were not able to bring in sufficient cash to keep their operations going. So, revenue cycle definitely impacts cash flow, profitability of the organization, and the ability to provide quality patient care. It also impacts claims processing, patient billing, reimbursement, and compliance. And I mention compliance because healthcare in the US is heavily regulated, and there are many laws, regulations, agencies that monitor healthcare that we have to be aware of and responsible to ensure that patients are treated fairly and are not billed inappropriately, and that government payers who are responsible for your tax dollars and managing your tax dollars are not paying for services rendered inappropriately. And we also want to make sure that our healthcare providers are receiving timely and accurate payments for services rendered, and that our patients are billed accurately. We don't want them billed for more than they should be billed. In other words, we want to bill for exactly, precisely what was done and not a penny more. There are stages in the revenue cycle, and we're going to talk about those stages first to give you an overview of what the different stages are, and then we'll talk about the different roles and careers, jobs that are in those different stages. Now, in some smaller organizations, you may have people who are doing all three stages. They could be doing scheduling and registration and charge capture and coding and billing and payment posting. You may have a single person. In larger organizations, these functions are usually split up, and you may have a single person doing your front end, single person doing middle, and another person doing the back end, or even multiple people doing pieces of each of those stages. So, in the front end of the revenue cycle, this is where your patient calls to schedule an appointment, or you may receive a referral from their physician to schedule an appointment for a patient. And these are the people who we call patient access. It could be front office staff in your physician's offices, or it could be the front desk staff in a hospital. It could be the registrar or the patient access department, registration department. It's called different things, and the people who work there are called different things, but generally it comes down to patient access. And the folks working in the front end are responsible for doing the scheduling and registration of the patient. So they're going to take that patient's information, which would include demographic information like their name, their date of birth, their address, phone number, social security number. They're going to obtain the insurance information if the patient is insured. So they'll get the group and subscriber number and confirm that it is accurate. And then they will register the patient into the system and schedule the patient for an appointment. It may be walk-in. They may have to do all of that at once and not actually go through scheduling. They simply do the registration piece. The registration will involve entering all of that information into the organization's health record or health system. And then they may be responsible for verifying eligibility and benefits. So that is confirming that the patient's insurance is active, that they are eligible under their payer's plan for whatever services are going to be provided. They'll determine if there are any limitations on the services that can be provided. And that could be things like allowed to have 20 treatments or allowed to be treated for 30 days. They'll confirm that they're in network or out of network with the payer. And when we talk about insurance payers in session 2, we will talk about in network and out of network and what that means. So essentially, these people are responsible for scheduling the patient, registering the patient, and confirming that the payer, the insurance payer, will cover whatever treatment the patient is going to receive. If the patient doesn't have insurance, they may also be responsible for providing a patient estimate on what the care is expected to cost. They may help patients to set up payment plans, or they may provide financial counseling to the patient to help them apply for any aid that might be available to them. They're also responsible for obtaining authorizations, and many insurance payers require specific services and treatments and procedures to be prior authorized or pre-authorized or pre-certified before they will cover the treatment. And this can happen through several different ways, which we will also talk about in the session where we talk about patient access. But this is a specific process that must be performed to ensure that the care will be covered by the payer. And these roles may be broken down. So you may have one person who is scheduling the patient, another person registering the patient, another responsible for eligibility and benefits verification, and another responsible for authorizations. Now, the middle of the revenue cycle is where the treatment or procedure, patient visit, patient encounter, or admission to inpatient hospital or skilled nursing facility or any other type of facility takes place. And it's in the middle of the revenue cycle that the patient is seen. So this is where the actual patient encounter happens. And there are a number of revenue cycle activities that take place in the middle of the revenue cycle. One of those activities is the actual clinical documentation. This is where your clinicians, physicians, NPs, PAs are entering information into the medical record. Then there is charge capture. So they may be entering charges themselves, or it may be somebody else that enters their charges. And then the medical record is coded. And medical coding is a specific function within revenue cycle. Often the people working in medical coding are certified through one of the professional organizations such as AAPC or AHIMA, and we have a whole session dedicated to medical coding. Essentially, medical coding involves identifying the treatments, procedures, or tests that were performed and assigning a specific code, as well as a specific code to the diagnoses that tell us why the patient is being treated. And so there's a whole specific discipline around that area. For clinical documentation, there is a place in revenue cycle for clinical documentation specialists, or EMR or EHR, that stands for electronic medical record or electronic health record specialist. And these folks focus on helping physicians and nurses and other clinicians to document efficiently and well in whatever medical record they are using. These people often come from a clinical background, so they understand how those notes should flow and what they should look like, and they understand sort of the mind of the clinician. So this is a good role for nurses, physicians, and other clinicians who perhaps want to take on a non-clinical role, but still keep their hands in the pie, so to speak. Charge capture could involve people who are actually capturing the charges or who are reconciling the charges and making sure that they were captured accurately. And this usually involves entering those charges into the organization's billing system. So, a number of roles here in middle revenue cycle. And then in the back end of the revenue cycle, this is where the billing takes place. Once a medical record has been coded, then a claim will be generated and it will be submitted to the payer. Or if the patient is self-pay, then a bill will be sent to the patient. Now, many times insurance payers will require that patients be responsible for part of the total payment. That is called deductibles, copays, and coinsurance. And so there could be quite a bit of back and forth between the first time a claim is submitted and then following up on that claim, posting the payment from the payer, and then generating another bill to a secondary insurance or then to the patient. So there is, in addition to generating the claims and submitting the claims, there's payment posting, and there can be these roles may be broken out in large organizations where different people will be responsible for the different roles. So there could be billers, professional billers who are generating the claims, posters who are posting the payments, accounts receivable, follow up, and patients collections. These people are responsible for taking the remittance advice or the information from the payers and identifying what was paid. Was it paid accurately? Were there any denials? And then following up as required. So they need to understand the claims, they need to understand what's on them, they need to understand what was billed, and then they need to understand the information back from the insurance payer. They may also be responsible for following up with patients to to set up payment plans or to bill patients on the back end, and then to manage any denials from the payers that are coming in. So this is why we call it the revenue cycle. And it's particularly appropriate if you have patients who return over and over again, such as with your primary care providers. You have the referral and scheduling, insurance verification and registration in your front end, your patient encounter documentation, charge capture, and coding in your middle, and your claim submission, claim adjudication, and that essentially is how the payer paid the claim, payment posting, and accounts receivable follow-up in the back end. So it is a team approach. It really takes a team approach to have an effective revenue cycle in an organization, and it takes many people. So we talked a little bit about some of the careers in revenue cycle. In patient access or front end revenue cycle, some of the careers could be in front desk, scheduling, registration, insurance and eligibility verification, authorization specialist, and financial counselor. Now, these are just some of the titles that you may see if you were going through a job site. So look for patient access, look for revenue cycle. Many times, this is a good place for entry-level people to get started in revenue cycle is in patient access. And these jobs are often easier to get if you don't have, let me reword that. So people who don't have a degree in healthcare, a college degree, or who may just have an associate's degree, or people who don't have extensive experience in healthcare, this may be where it's easiest for you to get your foot in the door with your first job. Now, middle revenue cycle, These jobs are usually going to require either education or certification or both, and they will often require some experience in healthcare before you can get a job in them. But it is certainly an area that's on the career path. So some of the jobs here would be clinical documentation specialist, medical coder, medical biller, claims analyst, and medical auditor. In the back office, medical biller, accounts receivable specialist, payment poster, denials manager, collections, reimbursement analyst. Again, just some of the job titles that you may see. This depends on the job role specifically and the requirements of the job role, how easy it is to get your first job in the back office of revenue cycle. In some cases, you may not need to have education or experience. In some cases, you may. So, depending again on the job title and the requirements of the job. And some of the other jobs that are in revenue cycle but don't fit squarely into the front, middle, or the back office would include things like charge master coordinator. Charge master coordinators are the people who set the prices for the different services and procedures and treatments. And there is a lot of work that goes behind that. Um, they they may use decision support analysts. And so these are your data folks. They usually have great Excel skills and data analysis skills, revenue integrity and compliance, regulatory specialist, consultant, revenue cycle manager. So these are often jobs on the career path in revenue cycle. Once you are in a revenue cycle job for a bit, you will get a better idea of where your career path may lay. If you love numbers and you really enjoy working with data, then charge master, decision support analyst could be great fits for you. If you really love working with patients, patient access might be the perfect place for you. If you love coding and billing, or you love being a detective and figuring out why claims weren't paid and how to get them paid, you may gravitate towards one of these areas. So you can see that depending on your personality, what you enjoy, the types of work that you like to do, whether you like to be around patients or you prefer to be in that back office position, you can see that you could go a lot of different ways in a revenue cycle career. So we talked a little bit about some of the career paths. Really, the sky is the limit. It can take you anywhere within an organization. Many people who start out in revenue cycle positions move up into administration in directorships or even up through vice president or CFO, depending on the role that they follow in the organization. So there's many opportunities to move up into administration. Some people move into consulting positions where they work with companies and that work with organizations and help them to improve their revenue cycle processes. And some people even take the entrepreneurship route where they become entrepreneurs owning their own medical billing or coding or consulting or other types of companies. And these are just, a little bit of the career paths that you might see. You could see people move into practice management, or you could conversely see people move from practice management into revenue cycle, as I did. So lots of different ways that you can go with a revenue cycle career. Let's talk about salaries a little bit because you're probably interested in what people in revenue cycle can make. Entry level, again, it depends on the type of position and where you're located in the country. So geography certainly does play a role. Your education and experience can play a role as well. But generally, anywhere from 30K to 50K a year would be reasonable to expect in an entry-level position. Mid-career, anywhere from 50 to 80,000 per year would be reasonable to expect. And senior level, this would be your directors, for example, 80 to 130,000 per year, again, depending on education, specialization, geography, etc. Certainly you can boost your salary, and we see that with some of the surveys that AAPC, the American Academy of Professional Coding, has done. They do a salary survey every year, and certainly the people who have gone on to obtain degrees or certifications tend to make more money. And I think that's probably standard across many, many careers. But you can see that this is not a career area where you are struggling to to um, to find enough money to buy bread, right? It certainly can be a lucrative career for many people. It is a professional career, and so you are treated as a professional, and there's I think, a great deal of satisfaction in that. So I just want to encourage you at the end, as we get close to the end of our time tonight, to think about what are you passionate about and what are your strengths and what are your long-term career objectives and what have you learned today that really excites you about healthcare revenue cycle. I find it very exciting. I love revenue cycle. I've had the opportunity to teach probably hundreds of people now in my current career, my current job role about revenue cycle. Um, it is a lot of fun, really, if you like numbers, if you enjoy if you enjoy ensuring that an organization is able to meet its mission to care for patients and to continue to carry out that work. It's I've met wonderful people in revenue cycle and have had a very enjoyable career and a lucrative career, I must say. So it has been a great step for me. So, just some things to think about before we get into our next session next week. I wanted to provide a little time for Q&A, and I'm just going to give you a couple of questions that I frequently hear from people, and I'll give you my best answers based on my experience. The first one is, do you have to have a degree to get a job in revenue cycle? And the answer is no. There are certainly jobs that you can obtain in revenue cycle in an entry-level position that don't require a degree. And even medical coders and billers can get into revenue cycle jobs without a degree. They just need to obtain the certification, and there are certainly ways to do that and to do it quickly. Um, so no, you don't. And actually, we will go out here in a second. I'm going to go back here for just a moment and pause my share. And I want to show you. Second. It's taking me just a moment to pull it up because my bar is hiding it. Okay, so here I have pulled up a job search on Indeed, and I've chosen healthcare revenue cycle, and I chose entry level, and I'm going to choose education. So you can see that there are 3,434 that only require a high school degree, and 4,279 that require an associate's degree. So there are a lot of jobs here that are available that you don't necessarily have to have a degree. So my next question is, what if you don't have any healthcare experience? Can you still get a job in revenue cycle? And again, the answer is yes. You don't necessarily have to have experience in healthcare. Now, many jobs are going to want some experience in healthcare or at least a knowledge or a background in revenue cycle. And that's what this boot camp is designed to provide you with, is that foundational knowledge of revenue cycle to help you get your foot in the door for your first job. But you don't necessarily have to have a degree or experience. So let's just look at this first one, which is for a revenue cycle clerk as needed, PRN. It's commonly used in healthcare to mean PRN. And let's look at what they want somebody to be able to do. Good knowledge of processing payments in terms of cash, credit cards, or checks. Great customer service skills. Knowledge of math and accounting procedures, balancing cash registers and drawers, and being well organized. Well, you could have maybe obtained that experience in working in a retail store, right, as a cashier. And so if you can do that, you can probably do this job. Now let's look what they want. Job qualifications, a high school degree. So this is basically a cashier job supporting patient financial services department by handling accounts assigned by the patient accounts manager. So these are another couple of job roles that you may see jobs for in revenue cycle. And this could be a great way to get your foot into the door in an organization. Let's see what we have here. Patient financial specialist. This one is weekends as needed. And what do they look for? It is support nature, and they are looking for people who have a high school diploma and post-high school education preferred, but not required. So now let's look at this one. This is a patient financial specialist in revenue cycle. This one requires a high school diploma or equivalency. So you could have your GED. They do prefer some high school education, but it's not required. And what does this person do? Productivity standards are met, daily EOBs. So that's an explanation of benefits from an insurance payer. We'll talk about insurance and EOBs on our insurance sessions. So they're logging issues. They're performing research to determine government requirements prior to claim submission. They're contacting clinical departments, medical records to get information required. They work with different departments, help to review and resolve claims. So many times your organization will train you in what you need to do to perform these jobs. And so this is a good example of someone who is following up on the claim. So financial specialist, this is another job role that you might see. Hospital medical biller. In this job, they are looking for someone with a high school diploma, associate's degree preferred. They do want somebody to have some post-high school education, but not necessarily a degree. And 18 to 24 months of relevant work experience or a combination of training and relevant work experience. And then some hospital billing and insurance claim processing experience, insurance or account follow-up techniques. So you will learn some of that in this boot camp to give you a foundation that you could potentially apply for a position such as this. And in this case, they're resolving patient billing inquiries and problems, following up on balances due. Revenue cycle associate. We'll just look at this last one. And again, they're verifying insurance benefits, processing batches of registration data, verifying against insurance records, and we need a high school education. Some vocational training, they're looking for 1 to 2 years of experience. So again, this boot camp will provide you some of that education and training that you might need. Understanding of basic medical billing office practices, experience with an electronic record system, Epic preferred. Now, I will tell you, even though they say they want you to have experience here and Epic preferred, every organization that has Epic as its electronic health record builds it its own way. And so they all require you to go through their own specific training. So don't let that throw you, especially if you see an organization that has Epic, they're going to train you on how to use their system. So you can see there are definitely some opportunities there, even if you don't have a degree or experience. So another question that I see often is I'm a recent coder and I'm having trouble getting a job because everybody wants experience and I don't have it yet. I have my coding certification and my apprentice designation, and now I'm having trouble getting my foot in the door. For you, revenue cycle can be a great entry, especially if you get into medical billing or accounts receivable follow-up or patient access. Some of those jobs that we've just looked at can be a really good start to get into the healthcare field, and then at some point move into the coding position that you want. As these organizations learn that you have the skills to understand the codes, because you definitely will be using the codes in any of these positions, they will be willing to move you into the other job roles that you may want. So again, this is where you have your revenue cycle career. Even if you're not necessarily getting straight into a medical coding job, there are ways into that job. It may just not be quite the direct route that you had originally hoped for. So I hope that answers some of the questions that you may have. And in our next session, I think we are going to be talking about patient access. So we'll be talking about that, the registration, benefits and eligibility, and we'll really dive deep into that. So thank you for listening. I appreciate your attention. I hope this has been helpful for you. Please feel free to reach out to me at help@revenuecycledecoded.com, or you can find me on Facebook at Revenue Cycle Bootcamp or on LinkedIn. And also Revenue Cycle Bootcamp on LinkedIn, or you can search for my profile. It's been a pleasure to speak with you this evening, and I look forward to you attending future sessions.